Hi, my name is Dr. Cooperstock and welcome back to the Spiegel Center Postoperative Care video series. Today we'll be demonstrating how to place your head wraps if you had mandible surgery, forehead contouring, a brow lift, or even possibly a facelift. The first thing you want to do is you want to apply the wrap that goes around the jaw to the top of the head. You want to make sure both ears are flat to make sure not to pinch them. You can place the ACE wrap underneath the chin, and you want to make sure this is snug but not uncomfortable, as it's keeping your incisions in the right position. You continue to wrap around in a circumferential manner, and then we'll get a second wrap which will occur around the forehead region. When placing the forehead wrap, you want to go right across the brow, and you can lean forward a little bit and then wrap once again in a circumferential manner, and this forehead wrap will help keep the jaw wrap in place in the immediate post-operative period. You'll be doing these wraps for approximately 1 week for the majority of the time during the day and the night, and then the Spiegel Center will provide you with additional instructions in regards to how long that wrap needs to be for the following time period.